I would like to ask both your permission to use this video for educational purpose and on internet.
Oh, yeah.
Yep.
Okay. Tell me about your symptoms before the surgery.
I had horrific pain
Mhm.
going all the way down my arm into my fingers. My fingers were absolutely numb, and I just couldn't sleep. I couldn't sit. I couldn't run. I couldn't do nothing.
The
basically,
surgery
without
was
being
what,
painful.
6 months ago? When was that?
4 months ago.
4 months ago.
Mhm.
How is that pain now?
Much better.
Okay.
Gone.
Gone.
Mhm.
When did you notice, especially the finger and hand symptoms, when did you notice they are gone?
Right away.
Right away.
Mhm.
How long did you stay in the hospital?
Just overnight.
Just over the night. Now, you got what we call a ACDF, anterior cervical discectomy and fusion. This is what we did. We took, this disc was pushing on the nerves. So what we did, we put a spacer in, lifted up, and then we put a small tiny screw above and below and internally braced it. Surgery took us about an hour, or actually a little less than an hour. And this is a question that many of my patients asking me, and that is the purpose of this interview, is that they're asking me, if you take that disc out, am I going to lose mobility? So what do you guys think?
No.
So,
No.
so what did you notice actually?
Actually, my pain was gone immediately.
Mm-hmm.
And then I noticed probably, as soon as I could take the brace off and
Mhm.
start
Yeah,
kind of moving around the house a little bit more, I noticed
yeah, and
much better. And I did physical therapy too, which
Yeah.
I really recommend.
yeah. And you told me as well that actually you noticed that the improvement. Tell me about it. How did you notice that she's improving in the head mobility? Tell me about it.
Well, that's just everything that she does. I mean,
Yeah.
it's like, I thought
Yeah.
that
No.
there was going to be, like, the side
Mhm.
would be lost. It's not.
No. Well, and that is exactly what I tell to my patient, that if you would have come to me and you told me after the fusion that you can move your neck less, you would be the first person in thousands of surgeries that I have done. And the reason for that is very easy. First of all, nature gives us much more than what we need.
Oh, yeah.
So only people who truly notice a reduction in the motion after this kind of surgery are Olympic gymnastic. If you don't do Olympic gymnastic, you're safe.
Actually, if you followed,
Yeah.
she followed what you guys said.
Yeah.
Recommendations.
Yeah,
Excellent.
recommendations to a T. So.
Ah, excellent. Now, but as well, what we notice as well that, by the time you come to us, this has no motion left in it. So us taking it out doesn't really,
It was huge.
yeah.
Mm-hmm.
For sure.
And that's why people after the surgery, when the pain is gone, they finally can use the mobility of the other levels, whereas before they couldn't do anything. So almost everybody tells me that the motion actually is getting better, and you're a proof of that.
Mhm.
Okay?
Yep.
For sure.
So how long did you have the pain before the surgery?
Well, now I think back, and I think it was probably herniating slowly.
Yeah, it does
for many
usually sometimes. Yeah,
years probably.
many years.
But it really got really bad, probably I would say the last 4 or 5 months
Before the surgery?
before surgery.
Would you have done anything differently,
No.
knowing everything you know?
Mm-mm.
So you just practically,
No, I probably would have came to you sooner.
Okay. Well, thank you so much for the interview. I really appreciate that.
Yep.